Weaver, and I'm a student with the Master's of Science in Nursing Education program at Indiana University, Indianapolis. This video was created to help women understand pathophysiologically what may happen soon or is currently happening with their bodies. Perimenopause and menopause are topics that have been taboo in the past, but more recently have been brought to the forefront with evidence-based research being done, as well as women owning their bodies and healthcare to protect their well-being. I hope that we can give you the validation that there are healthcare providers that care about your well-being and quality of life after your childbearing years. You are worth being in the best health you can be. After watching this video, we hope that you feel more empowered with your knowledge and the decisions in your care. During this video, we will clarify the differences between perimenopause and menopause and what that means for your symptoms and symptom management. We will take a deeper look at all of the different symptoms that have been identified, as well as the most common ones during this time period. There are different treatment options that can be explored by you and your provider that I will give more detail on. Finally, I'll give you a guide to your next steps in following up with your provider to make your healthcare decisions. So, let's first talk about perimenopause and menopause. Historically, menopause was the only word that was thrown around without any details on what that meant for women pathophysiologically. So, let's clarify. Menopause is 12 months without a menstrual period, whereas perimenopause is the natural transition period leading up to menopause. The average age for menopause is 40 years old to 58 years old, and since that transitional period can be up to 10 years, we can walk that time frame back to 30 years old to 48 years old for perimenopause. Let's take a deeper dive into perimenopause. Where historically women have been saying they are, quote, in menopause, end quote, the correct terminology would be perimenopause. Menopause is a singular day in a woman's life where they can say, I haven't had a period in 12 months. Perimenopause is all the hormonal changes leading up to that moment in time. Perimenopause initially starts when your ovaries are down to 30% of their original amount. We are born with all the eggs we will ever have in our ovaries, so this decrease in eggs is what causes a gradual decrease in estrogen, which is highest during childbearing years. The decrease in estrogen levels is what causes the perimenopausal and subsequent postmenopausal symptoms, such as hot flashes and night sweats. The estrogen level is not directly correlated with the severity of symptoms, which is why you might hear your provider say that checking your hormone levels might not be necessary in changing your plan of care. During perimenopause, there have been over 50 symptoms identified so far, with more being uncovered with the growing amount of research surrounding women's health after childbearing years. This diagram is a good visual as to how estrogen levels drop during menopause and stay down after your last period. If you look at the bottom, you can see that that level correlates to symptoms that can be expected as well as the severity. On the left, you'll see some of the most common symptoms, such as hot flashes, night sweats, vaginal dryness, and sleep problems. Where do we go from here? If you're having symptoms such as these, your healthcare provider may need to make sure that those symptoms do not have another underlying cause. Many of the symptoms can line up with other conditions, such as hypothyroidism or hyperthyroidism, or could be more serious, like heavy vaginal bleeding. With this in mind, your provider might order some labs, such as the thyroid stimulating hormone level for thyroid health, or TSH, hemoglobin A1C to check for diabetes, a complete blood count or a CBC to check for anemia, and an ultrasound to check for any abnormalities of the uterus or ovaries. It is important to note as well that if you have had a hysterectomy, irregular periods cannot be an indicator and may be harder to indicate if you are in that perimenopause stage. If there are no indicators that your symptoms are not being caused by anything other than perimenopause, your provider can discuss treatment options for you. Hormone replacement therapy, or HRT, has been proven to improve symptoms and quality of life for women. Unfortunately, due to a past misinterpreted and skewed study, many women are hesitant to do HRT. That particular study that HRT increases the risk for breast cancer has been debunked following numerous evidence-based studies and has shown that HRT does not significantly increase the risk for breast cancer, and in fact, has so many health benefits such as increased bone health, heart health, and dementia prevention. Hormone replacement therapy is available in estrogen and progesterone, which we will break down further on the next slide. There are patients that are not eligible for HRT, such as women who have clotting disorders, history of deep vein thrombosis, or have a history of breast cancer or liver disease. Those patients that are not candidates for HRT can still receive localized estrogen treatment, such as estradiol cream, that can decrease vaginal dryness. You and your provider can discuss different treatment options if you cannot receive HRT in an effort to target and manage specific symptoms. Another common question is what you should do if you are currently taking birth control. If you are currently taking birth control and it is keeping periods regular and is working for your symptom management, your provider can continue the dosage for that birth control. If there are new symptoms that have come up, the dosage can be increased, and for those who are taking estrogen or progesterone only birth control, the former or latter can be added to aid with symptom management with alternative interventions. So estrogen or progesterone, which one is the answer? Estrogen HRT supplements the body's decrease in estrogen, which improves symptom management of perimenopause, menopause, and postmenopause, such as decreasing incidence of hot flashes and vaginal dryness. It can increase bone and heart health as well as muscle strength. Systemic estrogen therapy is available in pill, patch, gel, ring, and mist. There are rare occasions in which systemic estrogen can be delivered by injection. Localized estrogen therapy is available in tablet, ring, and cream. Progesterone, on the other hand, keeps the lining of the uterus thin, which can also prevent endometrial cancer. Some of the benefits of progesterone are also that it promotes sleep, supports bone health, balances estrogen, can help boost mood, and helps decrease anxiety. Progesterone is available and FDA approved with an oral capsule, but it can also be administered via IUD or vaginally through creams. If you are currently taking estrogen, you can talk with your provider about also adding progesterone to your HRT. There was a lot of information given in this video, and I want you to have the tools to discuss with your provider. Here are some of the things your provider is going to want to know discussing perimenopause, menopause, and postmenopause treatments. I would suggest jotting these things down really quickly in a note on your phone or on a piece of paper if available. If you need to, feel free to pause this video on this slide so you can get an accurate and detailed list for your provider. Your provider would love to hear the answers to these questions. Are you having irregular periods? When did they start? How long are your cycles, and have they gotten longer or shorter recently? What symptoms are you having? When did they start? What symptoms are affecting your quality of life the most? What medications are you currently taking? And do you have a history of undiagnosed vaginal bleeding, estrogen-dependent cancers, history of breast cancer, history of deep vein thrombosis or DVT, heart attack, or liver disease? And what questions do you have for your treatment options? Your provider is looking forward to discussing this with you and improving your quality of life during this time. Contrary to historical context, your quality of life and happiness deserves to continue after your childbearing years. Take control of your care and your body. Thank you so much.